Maintaining physical health is something that, as we get older, becomes more and more of a consideration. And that's no different for members of the armed forces, their families and veterans. But while military service can provide opportunities, there's a real risk that it can lead to barriers too. Enter the Veterans Covenant Healthcare Alliance, a dedicated network of healthcare professionals in both the Armed Forces and NHS. Right now, 60% of NHS trusts in England and Wales are what the scheme call veteran aware. And at trusts like this one in Shropshire, the work to improve the care veterans face in the hospital is led by veterans themselves.
Me being a reservist in 202 Field Hospital, I need to, when not deployed, I need to be connected with military people. And one mechanism of doing that is through the veteran awareness work. So that ensures that I'm still mindful and connected to serving personnel as well as veterans. To be an effective doctor, I need to be able to communicate. And one particular aspect of that is identifying the veterans, because I know, as highlighted in the Armed Forces Covenant, they are at risk of disadvantage through their service.
What we're trying to do is to mitigate all noise levels within the hospital, especially at night. And especially for our veterans. So this spin, same process, foot pedal, and then when you release it, it closes softly, and it is a soft close, so no noise at all. I've been a nurse for 42 years. I retired as a major, did a tour of Afghanistan in 2009. So when we have a patient admitted to the hospital, every patient we fill out a nursing booklet, a nursing admission booklet. We ask every patient whether or not they're a serving member of the armed forces or whether any of their family are, and whether or not they're a veteran. If that patient wants the veteran awareness scheme to be notified, we will notify them that there's a serving member or a veteran within the hospital.
The best practices from veteran-aware trusts like the Shrewsbury and Telford Hospital NHS Trust are being shared at a conference in Birmingham.
When a veteran comes to hospital, they ask the question, are you a veteran? Have you served? What about are your medical conditions? Is there anything you need? Can we signpost you to people that can help you, the charities, etc., so that we make sure we're going to give them a very good experience along with their treatment. And if we can provide that, then we are paying back as a nation to the veterans for what they've done for the nation while they've been serving.
The work of the Alliance aims to be encompassing of all aspects of care.
My connection to the conference, it stems from a cruel twist of fate where my daughter was taken very ill. She had leukemia. She required 2.5 years of treatment. It was brutal for the family. It was brutal as a parent and clearly awful for my daughter to go through. But the work, the agreements of the Armed Forces Covenants, the links, the policy which is in place between the military and the NHS meant that my daughter could get great treatment, but it also allowed me to continue my role in the Armed Forces.
With more than half of NHS trusts in England already achieving the status of being veteran aware, the Alliance is now focused on the continuous improvement of healthcare in those hospitals and trusts. By the end of next year, the Alliance says there's a real chance that every NHS trust in England will be there, veteran aware, providing better healthcare for the whole Forces community. James Wharton, Forces News, Birmingham. If you enjoyed this video, don't forget to like and subscribe to our channel.